I had to do something to get back to what my original intention was, which was serving my community. As far as transitioning from my previous chain pharmacy experience to independent pharmacy, it was chain pharmacist one day and independent pharmacy owner the next. Swadley's was the pharmacy that I acquired, and it is the only other pharmacy in town besides the chain that I had previously worked for. I feel that the pharmacy transition services for my purchase of the pharmacy was absolutely essential.
My decision to buy a pharmacy was a big push from Leslie.
Well, I would say that probably more I was like this: you should buy Stimble's.
Leslie and I worked together for the same big chain. Growing up in Fowler, I knew Stimble Pharmacy was the hometown pharmacy where I went to. So it wasn't a far off, find a pharmacy to buy. It was my local store that I had been to.
When Angie approached me, one of the things that was so appealing was that she was a young woman. My sense was that Fowler would have a pharmacy for another 30 years. One of my concerns was that she understand what she was getting into. There certainly are wonderful things about owning your own business, but there's some things that are a bit of a challenge too.
Sherry was already using Cardinal Health. It was talking to Leslie that she had used the transition team, and she put me in touch with Brett Fortier.
So our starting point, no matter if it's a buyer bringing us an opportunity to acquire another pharmacy, or if we're going to work with a pharmacy owner who's just getting started, we need to understand, what's this business worth?
The whole idea of how do you know how much a pharmacy is worth? Where do you get this number? And that was a lot of the reason that we turned to Cardinal and the transition team. Was we needed a third party who was going to find a fair value for both buyer and seller.
I felt really good about Cardinal having access to both me and the buyer, because I wanted to be sure we didn't go through this process and waste lots of time on a buyer who either would back out at the last minute or would not be able to secure financing.
Working with Cardinal Health to purchase some pharmacy, they make it very easy. They give you the transition team.
Licenses, you need bankers, you need attorneys and accountants and all of those things.
All of the requirements for buying or selling a pharmacy are taken care of.
It was very nice to have a resource of people to know even where to start.
One of the advantages of the buying and selling of pharmacies today is there's a lot of lending available, and that wasn't the case 10 years ago and before. We don't have to rely on heavy amounts of cash down. We don't have to rely on sellers carrying an entire note. And in fact, Cardinal Health has become a very experienced lender ourselves.
We, over the years, had numerous times that chains had approached us wanting to buy us out, but my husband's philosophy was always that we could serve our community so much better by being independent.
I really think that it was important for Sherry to have someone who is local to come back and take care of the people of our town, rather than selling out to a big box.
The beauty of this specific program is that there is no charge, and Cardinal, I think, is so intent on keeping independent pharmacies independent that that's the payoff for them.
Selling your pharmacy can be very difficult and often emotional because it's your legacy, and we want to make sure that the succession plan we've put in place is bringing the right person in to take that over and carry the torch in the community.
They were very accessible. I felt like questions that I had got answered in a very timely manner, and really felt like I developed a relationship with the Cardinal transition team folks.
We don't limit ourselves in who we work with. It doesn't matter if the pharmacy is a Cardinal Health store or using a different supplier. We treat everybody the same.
If I were to purchase another pharmacy or expand my business, I would definitely reach out to the Cardinal Health Transition Services team for valuation and new knowledge of the market and industry, whether it be an existing pharmacy acquisition or a startup.
A year into owning my own pharmacy, I'm excited that I'm still able to do this. It makes me happy to know that I'm able to continue the tradition of caring for my community that I grew up in.
Cardinal just was a very people-oriented organization, and the reason that we selected them is felt that they really valued strong relationships.
Because ultimately what we're trying to do is keep independent pharmacies independently owned.